Aspirin is a non-steroidal anti-inflammatory drug or an NSAID, and the active ingredient in aspirin is a compound called acetylsalicylic acid. The history of aspirin dates back to about 3,000 years ago, when the bark of willow tree was used to relieve pain and reduce fever. Later on, the active ingredient in willow bark was extracted and named salicin. In 1838, an Italian chemist, Raphael Perea, synthesized salicylic acid, which is a stronger form of this active ingredient in willow bark. And it worked for pain, fever, and inflammation, but also caused gastric irritation as a side effect. So in the following years, research was directed towards the chemical modification of salicylic acid to obtain a better tolerated compound. And then in 1899, a chemist named Felix Hoffmann at the Bayer Pharmaceutical Company in Germany came up with a way to modify salicylic acid to make it less toxic. And the process he came up with involved a reaction known as acetylation. It replaced one of salicylic acid's hydroxyl groups with an acetyl group to generate acetylsalicylic acid, which is the modern active ingredient in aspirin. But gastric irritation was still a side effect. This was just a safer and less toxic version compared to the regular salicylic acid. So now let's talk about its mechanism of action. It all starts with arachidonic acid, which is a regular constituent of cell membrane phospholipids, and it's an inflammatory mediator. By the action of the enzyme phospholipase A2, arachidonic acid is cleaved or freed from the phospholipid. When it's freed, it can take one of two pathways. It can either take the cyclooxygenase pathway, which will synthesize prostaglandins and thromboxanes, or it can take the lipoxygenase pathway, which will synthesize leukotrienes. But for the purpose of this video, we'll focus on just the cyclooxygenase pathway. Also, let's keep in mind that steroids inhibit the enzyme phospholipase A2, and this explains why steroids are anti-inflammatory, because if they inhibit this enzyme, arachidonic acid won't be freed from the cell membrane phospholipid to mediate the synthesis of inflammatory mediators like prostaglandins and leukotrienes. The cyclooxygenase pathway involves the enzyme cyclooxygenase, or COX for short. This COX enzyme adds two oxygen groups to arachidonic acid to produce prostaglandin G2, which is abbreviated as PGG2. Once PGG2 is formed, it is reduced by peroxidase enzymes to form prostaglandin H2 or PGH2, which is the direct precursor for prostaglandin D2, prostaglandin E2, prostaglandin F2 alpha, prostaglandin I2 or prostacyclin, and thromboxane A2. So there are two major COX enzymes, COX1 and COX2, and while both isoforms catalyze the same reaction, which is converting arachidonic acid to endoperoxide, which will then be converted to prostaglandins and thromboxane A2, there is a difference in the roles they play in the body. COX1 is a constitutive enzyme in most tissues, and it mediates the synthesis of prostaglandins that perform housekeeping functions like inducing the secretion of protective mucus in the gastric mucosa, decreasing the secretion of gastric acid, and also in the regulation of renal blood flow. It also mediates the synthesis of thromboxane A2, which causes vasoconstriction and promotes platelet aggregation. COX2, on the other hand, is not normally present in most tissues and is the inducible form, which means it is induced by cytokines and other signaling molecules at the site of inflammation and other pathological changes to produce prostaglandins, which mediate inflammation. However, COX2 is constitutively present in some sites in the kidney, brain, and in fetuses, and they may play physiological roles at these sites. So during fetal circulation, prostaglandin E2 produced by COX2 enzyme keeps the arterial duct open. And then at birth, some unknown mechanism switch off this synthesis and the duct closes. So COX2 plays the role of producing prostaglandins that will keep the arterial duct open during fetal circulation. Aspirin irreversibly inhibits COX enzymes. It's a non-selective inhibitor of both COX1 and COX2 enzymes. Aspirin has antipyretic effect, which means it reduces fever. So fever during infection or tissue injury is produced through the generation of pyrogens like interleukin-1 and tumor necrosis factor alpha that induce prostaglandin E2 production in the hypothalamus, which raises the temperature set point to a higher degree. So aspirin lowers the body temperature by blocking prostaglandin E2 synthesis and release. Aspirin works as an analgesic by inhibiting the synthesis of prostaglandins that sensitize nociceptors to bradykinin and other analgesic substances. Aspirin also has anti-inflammatory effects, and this is due to the inhibition of COX-2 enzyme, which produces prostaglandins that mediate inflammation. But there is some evidence that inhibiting COX-1 also contributes to the suppression of inflammation, especially in the initial stages. COX-1 mediates the synthesis of thromboxane A2 in platelets, which is a vasoconstrictor and a procoagulant, so it promotes platelet aggregation for blood to start clotting. Aspirin acts as an antiplatelet drug through the irreversible inhibition of COX-1 enzyme, which in turn inhibits the synthesis of thromboxane A2 in the platelets. So aspirin is considered a potent antiplatelet drug because thromboxane A2 is produced by the platelet, and platelets do not have nucleus. So if aspirin inhibits the synthesis of thromboxane A2, platelets cannot synthesize new COX enzymes to produce thromboxane A2, hence no blood clotting is possible for the entire lifespan of the platelet. Now we know that aspirin has anti-inflammatory, antipyretic, analgesic, and antiplatelet effects. The next thing we'll look at is its indications or clinical uses. It's used to prevent myocardial infarction and its recurrence, and it's also used in the prophylaxis of transient ischemic attack and ischemic stroke. In myocardial infarction, blood clots form in the arteries that supply blood to the heart and blocks the flow of blood. So if aspirin is blocking the synthesis of thromboxane A2, there won't be platelet aggregation and there won't be clot formation. It's used in transient ischemic attack and ischemic stroke because of the same reason. So in these disease conditions, blood clots form in the arteries that supply blood to the brain and restrict the flow of blood. So if aspirin works by inhibiting COX-1 enzyme, means there would be no production of thromboxane A2, hence no platelet aggregation and no clot formation. And this cuts the likelihood of clots forming in the arteries to block the flow of blood. It's used in rheumatoid arthritis because of its analgesic and anti-inflammatory effects. And because of its antipyretic effects, it's used to reduce fever. It's also used in osteoarthritis, Kawasaki disease, and for headache. The next thing we'll talk about is its side effects. So recall that I said COX-1 produces prostaglandins that protect the gastric mucosa and reduce acid production. So if aspirin is blocking COX-1 enzyme, the stomach loses its protection, and this can lead to gastric ulcer. So that's one side effect of aspirin. And also COX-1 produces thromboxane A2, which helps in blood coagulation. So if aspirin is inhibiting COX-1 enzyme, it means there won't be coagulation, and if there is no coagulation, it will result in bleeding. It can also cause Reyes syndrome, which is swelling in the liver and the brain, and it usually affects children who are recovering from a viral infection like chickenpox. It's contraindicated in gastric ulcer, ulcerative colitis, bleeding disorders, bronchial asthma, and in patients who are allergic to salicylate. Administering aspirin together with many classes of drugs may produce undesirable side effects. For instance, administering aspirin together with warfarin would increase the risk of bleeding. So warfarin inhibits the vitamin K dependent coagulation factors, and if there are no coagulation factors, it will lead to bleeding. And we also learned that aspirin causes bleeding, so this increases the risk. Also, aspirin displaces some drugs from their protein binding sites. So aspirin is capable of displacing warfarin from its binding site, and when this happens, warfarin can float freely in the bloodstream to cause bleeding. So that's why giving aspirin together with warfarin would increase the risk of bleeding. Aspirin plus alcohol increases the risk of peptic ulcer and GI bleeding. So aspirin inhibits COX-1 enzyme, which mediates the synthesis of prostaglandins that protects the stomach lining. And when it's inhibited, there would be no gastric protection. Alcohol destroys the stomach lining, so a combination of both can increase the risk of peptic ulcers and gastrointestinal bleeding. Also, administering aspirin together with penicillin G would increase the risk of penicillin G toxicity. Aspirin is usually taken orally, but it's also available in suppository and IV preparations. It is absorbed in the stomach and small intestine by passive diffusion. At normal low doses, it is hydrolyzed to form salicylic acid and acetic acid by esterases, which are present in the blood. Salicylic acid is then metabolized in the liver, where it's converted to water-soluble conjugates. which is finally excreted with urine. Let's do a quick review of what we've learned so far. So arachidonic acid is a regular constituent of membrane phospholipids, which is cleaved from the phospholipid by the enzyme phospholipase A2. When it's freed, it enters the cyclooxygenase pathway to form prostaglandins and thromboxanes by the help of COX enzymes. There are two types of COX enzymes, COX-1 and COX-2. COX-1 mediates the synthesis of prostaglandins that induce the secretion of protective mucus in the stomach mucosa. It also produces thromboxane A2, which is a vasoconstrictor and a procoagulant. COX-2 produces prostaglandins, which mediates inflammatory and other pathological processes, but can also perform some physiological roles in the brain and in fetuses. Aspirin has anti-inflammatory, antipyretic, analgesic, and antiplatelet effects. And because aspirin inhibits COX-1, it causes bleeding and gastric ulcers. It can also lead to Reyes syndrome, especially in children who are recovering from a viral infection like chickenpox. It's used in the prevention of heart attack, which is also known as myocardial infarction, and it's also used in the prophylaxis of transient ischemic attack and ischemic stroke. It's used in rheumatoid arthritis, osteoarthritis, fever, and to relieve pain. Aspirin is contraindicated in bleeding disorders, gastric ulcer, asthma, and in patients who are allergic to salicylates. It's absorbed by the stomach and intestines, hydrolyzed to salicylic acid and acetic acid by esterases in the blood. Salicylic acid is then converted to water-soluble conjugates in the liver and is finally excreted with urine. So that brings us to the end of the video. And as usual, there is an MCQ at the end of each video, so here is the question. Which enzyme is irreversibly inhibited by aspirin? A. Lipoxygenase, B. Cyclooxygenase, C. Thromboxane synthase, and D. Phospholipase. So what do you think the correct answer is? You can leave your answer in the comment section and we'll discuss it in our next video. Thank you for staying to the end. And if this video was helpful, kindly give it a thumbs up, share, subscribe, and also turn on your post notification bell so you don't miss any video we upload, and we'll be back with more videos.